So, the definition, the evaluation of the neck by observation, palpation, or auscultation. So, purpose. So, that to determine any abnormalities and have early diagnosis to check if there are any noticeable or enlargement of the lymph nodes and the hydroid gland to check if the trachea is at the midline. So the equipment are small amount of water. So the consideration before, during, and after the procedure is to identify the patient and explain the procedure and observe any abnormalities and perform hand hygiene and to provide privacy. So the things to document after the procedure, document any abnormalities that are detected, record the patient's response to the examination.
Perform hand washing and do gloves. This is to prevent spread of microorganism. Inspect the neck muscles and condition of the skin. Note for any scars and abnormal swelling and masses. This to make sure that the neck muscles are symmetrical and skin are intact. Place the palm of your hand against the client's right cheek and tell him his head against the resistance of your hand. Repeat on the other side. This to assess the muscle strength of the neck. Instruct the client to move his head through the entire range of motion and shrug his shoulder against your arm while he is sitting. This to assess the proper function of the neck muscles and the spinal accessory nerve. Locate the lymph nodes of the size, shape, symmetry, mobility, and tenderness. This to ensure the neck lymph nodes are non-tender or inflamed. Palpate them with your finger pads while moving in a gentle rotating motion. This gentle rotating motion is needed in order not to introduce pain to the client. Palpate the trachea by placing one finger along the side of the trachea and check for the symmetry or deviation between its two sides. This to determine any deviation of abnormal placement of the trachea. Palpate the trachea by standing behind the patient and put your hands around his neck with a finger of both hands over the lower trachea. For posterior approach, stand behind the client and ask him to bend his head slightly forward and to the left. And place your hands around the client's neck with the fingertips on the lower half of the neck over the trachea. Ask the client to swallow a sip of water and feel the trine nodes as it rises up. Repeat it on the other left side by asking the client to slightly move his head to the right side. This to determine presence of the mass, enlargement, and nodules and tenderness or crazy sensation. Anterior approach. Stand in the front of the client and ask the client to slightly flex his neck to the left. Place hands on the neck and apply gently pressure on the exposed side of the trachea. While palpating the other side as the client, swallow a sip of water. Ask the client to slightly flex his or neck to the right and repeat the procedure on the left side. This to determine presence of mass enlargement, noodles, and tenderness of gravity sensation. If the trigland is enlarged of the mass, auscultate with the bell of the stethoscope over the carotid arteries and the thyroid area for a breath. This to determine hypertabolic state or narrowed blood vessel.